Hello, everyone. Good evening. Hope you all are doing well. We're going to be starting the talk in just 3 minutes. So just hang in there, just to wait for everyone to come on, and then we start. Hi, everyone. So, as someone requested, I probably think it's a good idea to start with um, just discussing about the 7 or 8 questions that were there yesterday. Um, so the first question was the most important thing that I need to perform research is, well, a question. Um, for those of you who attended, you definitely know that because we definitely harped on it. So I did, and so did Dr. Neil. Um, you should always frame your hypothesis so that it always proves that the experiment will not work. That's the correct one, as we discussed in the null hypothesis situation. We have to always frame a hypothesis such that we prove that experiment will not work. So even if we find a little evidence of it working, we can, say that there is some association. After figuring out a vague research question, the next most important thing to do is literature review. As we're going to discuss today, we're going to be talking about all about literature review and how you're going to frame your topic, which involves a lot of literature review as well. Next question, which is following statements are true. Research in medical school is linked to success as a physician. The others are at least not yet proved to be true. Which of the following are the most reliable? They're actually systematic reviews and meta-analysis, as we discussed yesterday. which is the following is true about clinical trials. So most of you said that they follow a Prisma checklist, which is not right. Prisma checklist is actually followed by the review articles, like we had discussed. Clinical trials follow something called the consort checklist. Don't worry, you don't need to know these things. It was just the main thing I wanted you to know, that the clinical trials need prior registration, and that was the right answer. Which of the following is the least evidence-based source? Case reports, as we had discussed yesterday. Which is true about letters to editors and commentary articles is that it requires invitation from journals. It's not the highest importance given because experts are writing it. Okay. So now let's move on to discuss just a small 2-minute recap about what we did yesterday. Some of you may have missed it. Some of you may have not understood it completely. I'll just take 5 minutes of your time to discuss about what we spoke about yesterday. So we start with a recap into day one. And the first question that we answered, and the whole slide that was about what is research? It's basically looking for a question and finding answers out. As we had discussed, research is based on your curiosity, your ability to better yourself, better even your colleagues, or even better the treatment that you give to your patients. Essentially, research, if you have a question, research is not too complex. It just, you have to record stuff in a manner that others can figure out what you're trying to do. And then after all that, you have to publish your data. We discussed the different types of articles. Original articles, the most common type of articles that are present most commonly that you all will be writing. Review articles, which are basically a conglomeration of all other articles on the subject, which give you the most wholesome view of what a topic is actually what the relation between two things are, or what a particular research topic, the results of a particular research topic. The letter to editors, again, are invited articles that editors of a journal ask experts in their field to comment upon an original article or a review article, and they give their comments. It's not research per se, it's just their opinion on things. And as we discuss in great detail, clinical trials are one of the most resilient and robust ways of performing research, require a lot of money, a lot of time, a lot of experience. And if you do ever get a chance to volunteer for a clinical trial, I personally feel you should definitely do it. Again, we discussed the evidence levels of articles, systematic reviews, and meta-analysis are given the topmost priority. They're level 1. That means that if ever you want to find something out, whether this works in this disease or whether this treatment is good for this disease, rely on level 1 evidence. If it's not available, move to level 2, which are your original articles. Level 3, again, original articles. And if there is none of those are available, then you rely on case notes and expert opinions, right? Why you should do research, Dr. Neil went into great detail about how you should do it for yourself to improve yourself. If you're suffering complications in a patient, you ask yourself, why is that happening? For other doctors in your field, see that with their permission, of course, see the techniques that they are using. Maybe you're using a different technique. Maybe they are getting better results. Maybe you are getting better results. Improve yourself, improve others. Most importantly, for community at large and for your patients. Whatever conclusion you draw from your research paper, they will definitely be used by others for improvement of their patient performance. To us, patient performance is just such an objective term, but to the individual patients that we have, it's their whole life, right? So someone yesterday had asked, why don't journals just accept articles from medical students, and rejecting from, I mean, the rejection of articles from medical students in journals will cause them to feel, demotivated, dejected and stuff. But what happens is, if your article is not up to the mark, right? And if they publish it, and if some researcher somewhere cites your articles and gives a particular patient some drug, saying because he read in your article that, oh, this drug is effective, then there may be a problem, right? If your research is not done in the proper manner and you are drawing conclusions that are not right, you are affecting not only not only your own patients, but also patients who are also doctors, patients who are reading it from all over the world, right? So that's why that is not done. And that completes a small recap of what we had discussed yesterday. And today, I'd like to move on by discussing more about how do you hone down on a research topic. So everyone good? We can start with the topic.
Yes, sir, we can start.
Okay. Just give me 1 second. Just Zoom is a little more complicated than I thought. All right. So now we're going to talk about selecting a research topic and how the fact that picking your topic in reality itself is research. You can't just pick a topic out of the air saying, today I want to study coronavirus. But what about coronavirus do you want to study? Where do you want to study it? On what sort of patients do you want to study it? Mild, asymptomatic, what sort of? So you need to define your research question, right? And see, like I said, the most important thing in the start is to have a question. And then you can move on to how to refine it and how to make it more specific, right? So the first tip or the first opinion that I would like to share with you all is that just be flexible. Don't be stuck to one topic because it's in the news today. Don't be stuck to one particular aspect of your research, because in the end, oh, 1 second, I'm facing some issues. Oh my God. Come on, Zoom. Okay. All right. So in the end, what happens is that you may have heard some new topic that you have heard in a lecture that you're having in college, or you might have read it in a newspaper or something. But before you embark on your journey, just be a little flexible and just, take your time to make sure that the research that you're doing is actually important in the for the concept of the whole world, and that you and it needs to be focused, right? So this thing that you need to do is decide whether you want to have a clinical or a laboratory research. You want to consult an expert and you want to do your background research or the literature review that we spoke about yesterday. You want to identify new and but yet feasible ideas. Consider you say, okay, I want to study the coronavirus, it's in the news, it'll make me a famous researcher. And you think, okay, let's research whether this one's what's his name, Baba Ramdev's new drug works on people or not. You can definitely do that research. It's new, it's novel, and it is feasible, right? But if you think, okay, I'm going to take the whole population of Maharashtra, see how many are infected with coronavirus, see why some people are not and some people are, that's not possible, right? So develop ideas that are new but also that are feasible. So the first step after being flexible is you should identify a broad research area that you find yourself interested in. It can range from anatomy to medicine to surgery to OBGY to physiology, anything that finds you interesting. Because you remember that research is not a 2-day job, it's not a 1-week job. Okay. Good research that will get into great journals requires hard work, and it needs you to be interested in that sort of in that particular field, right? So if you're definitely not interested in a particular topic, you won't end up finishing your research. You'll be disheartened. You'll think, okay, मेरे को बहुत काम है, मेरे को research करना है, मेरे को MBBS का पढ़ाई करना है. So that just won't happen. So just make sure that you identify a broad area of research, that you're at least interested in that area, right? Or even if you identify an organ system, say the liver you find fascinating because of the multiple things that it do, the cardiac you find fascinating because of the mechanical aspect to it. Whatever you do, right? Just identify a broad area of research and then perform your background research, right? You speak to experts, you approach your faculty, write emails to people who you know are in the field. It is not uncommon to find people who will motivate you to perform this research in a particular topic. And they will definitely guide you along the way. Speak to your HODs. If your HOD is not interested in research, speak to the associate professor, speak to assistant professor, speak to your residents who will definitely know more about you and will know what the latest guidelines are, how they require any change, and what research can you do on that particular topic, right? We, like I said yesterday, we have a limited understanding of a subject, but we need in-depth knowledge to know, okay, this is what's working today, this is what's not working, this is where the areas of research are present. So the main point of research is you're heading into somewhere where there is an unknown, right? If you perform today research on smoking and lung cancer, people are not going to be interested in your research. The whole point of you taking your time out, you involving other people into your research is that you find out something that people did not know before, right? So definitely you need someone or the other who's an expert in that particular topic to guide you to your through your research projects, and so that you come to at least the research topic. It's not that, okay, sir, I have identified my topic and now please guide me on how I will do this research. Unless you have done your background research, unless you have contacted somebody who's an expert in the field, it makes no sense for you to already identify your research topic, because you will not know whether it is pertinent or not. And if a person without a pertinent research topic goes to say an HOD with, sir, ye meko research topic karna hai, he'll say, but this research is already done. And then again, you will take 3 weeks, you come up with a research topic. Again, he'll say, no, this is already done. Isn't it better, in fact, to just ask him, sir, I want to do research in the field of medicine. What can I do? He maybe won't give you a research topic right then, but he'll tell you, so see, these are the 5 P's: CT scan, and pneumonia pe kuch research, or something or the other. He'll give you some sort of guidance as to what those topics are. And once you establish those topics with what you learned today about PubMed and about Google Scholar and stuff, and how to search for your literature, you will definitely be able to come up with some articles that are very rare, and maybe you can replicate those studies or develop a new research protocol altogether. Okay. So there is a short video that I'd like to show you. It's about how picking your topic is actually research. It gives a short intro into this whole talk that we're about today. Um, Let me just share this. Okay. Okay, no. Can you all hear this possibly? Could someone give me an indication in the... Can you all hear this?
No, sir, we cannot hear it.
No, y'all cannot hear? Okay, just give me 1 second.
Yeah.
Okay, guys, I'm just gonna give me 1 minute to just figure this out. Okay, now y'all will be able to hear it. No?
No, sir, we are not able to hear. Neither on Zoom nor on YouTube.
Okay. How about now?
Meet Jenny. Jenny has a research project due in a few days.
Yeah.
She picked a topic when her professor
Yeah.
first assigned the project. She chose her favorite TV show, Bridezillas. It seemed like a good idea, but now that she's doing her research, she's having a lot of trouble finding sources. She's freaking out. Jenny's problem started with her mental model of the research process, which she sees as a one-way street. Like many students, Jenny thinks that once a project is assigned, she should pick her topic right away. Then she can move on to finding sources and reading through them. And once she has all her sources, she can start writing her paper. But the research process is a lot messier than that, and picking your topic is intertwined with finding and reading sources, and writing and editing your paper. Picking your topic is research. When you first pick a research topic, it isn't set in stone. It's just an idea that you test with some exploratory research. If it looks good, you find and read some more sources. At this point, you might find that the published research leads you away from your original topic. That's okay. You can let the research you find guide you and tweak your topic a bit. And by the time you've gone through this cycle a few times, you may find that you have enough sources to start writing and editing your paper. Even then, as you're writing, you may find that you need to pull in additional pieces of information, and you may return to the research cycle. So, let's wind back the clock for Jenny, bringing her back to the day her professor assigned this project, and allow her to do it again with this research model. Again, Jenny picks a topic that is interesting to her, the reality TV show Bridezillas. As she tests the topic with some internet research and in article databases, she discovers that there is lots written about it in the popular press, but not much scholarly research which her professor requires. Realizing that maybe her topic is a bit too narrowly defined, Jenny decides to tweak it by broadening her scope to reality TV in general. But when she tests this new topic, she winds up drowning in a sea of research, all of which has to do with reality TV, but doesn't tie together to help her form a coherent thesis. Back at the drawing board, she wonders if there's a happy medium between Bridezillas, which is too narrow a topic, and reality TV, which is too broad. Since Bridezillas is just one of several reality TV shows about brides and weddings, perhaps there's more written about this subgenre. Testing this topic in some of the library's research databases yields a promising but not overwhelming number of results. Instead of realizing too late that her topic was unresearchable, Jenny built in the time to test and tweak her topic, so she could take her original idea and shape it into a topic that she still finds interesting and can realistically use for a short research assignment.
So you guys got a basic understanding of why a topic cannot be too broad or too narrow, right? So you do not want to select a topic like gastroendoscopy or just hernia in general, right? Because you'll find too much on it. So you have to simplify your research based on some tips and tricks that we're going to talk about now. But you basically understand why your topic cannot be too broad or too narrow, right? So you don't start with, okay, I want to study the effect of say indomethacin in COVID-19 patients who are aged 0 to 10, because that won't give you a lot of results that you might get otherwise while putting in the same effort. But just just through this method of just going back, doing background research, talking to a lot of your guides, and then getting back to your topic. So people sometimes think that, oh, I've read about this in the paper, wow, this is such a great research topic, I'm going to write a paper on it. But that should not be the case, because usually it ends up being too narrow, right? So another short video that actually helps you understand what you can avoid, the pitfalls that you can avoid while choosing a research topic.
Choosing a manageable research topic, avoiding pitfalls. Is a monster topic out to get you? Beginning researchers often pick a broad, general topic, thinking that big topics are easier to research. But some topics are just too big. Consider these examples: global warming, eating disorders, physical fitness, media violence. It's too much! Problems with big topics. You cannot adequately cover a large topic in a brief paper. You will be overwhelmed with research material. You cannot research or write about a topic if you cannot define it clearly. Solution: ask questions: who, what, where, when, how. For the topic benefits of exercise, ask who might benefit, such as women, smokers, overweight children, the elderly. Ask what kind of benefits, such as lose weight, improve mental awareness, reduce stress, lower blood pressure. Now that big topic becomes smaller. Can exercise improve memory and cognition in the elderly? To narrow your topic, focus on a single event, a specific group, a limited time period, one cause or effect, one argument or viewpoint. For the topic death penalty, focus on an argument or viewpoint. Is the death penalty a form of cruel and unusual punishment? For the topic voting, focus on a group of people. Are there gender differences in American voting patterns? For the topic eating disorders, focus on cause or effect. Do genetics contribute to anorexia nervosa? Of course, some topics are too small, making published information difficult or impossible to find. Topic: how do Martians in the Inland Empire cope with the stress of being chased by ravenous topic monsters? The focus is too tight. A specific group in specific place with a specific condition and a specific psychological effect. If your topic is too small, try removing or broadening some of the specific conditions, but be careful not to make the topic too broad again, or you may end up like our Martian friend. Activity.
Right. So I hope with these two videos, you will be able to understand a basic way of how you can go around choosing your research topic. You just pick out a particular disease that's infecting someone and just say who, what, why, when, and where, right? And that allows you to narrow your topic. But sometimes, because we as medical students are not studying about voting rights or debates on the death penalty, we tend to have a little more complicated topics, right? So what we need to do in that aspect is, if our topic does become too narrow, like the lady in the video said, just remove certain specific associations with it. So if you're studying who, what, why, when, where, maybe just remove the where, right? So how you select your topic in research is you go from a broad subject, ask yourself any different sort of questions, right? Most important being who, what, why, when, where. Suppose if you study college goers, okay? Your topic could be evaluating some sort of relationship between physical activity in those college goers and its effect on different factors, right? Suppose you want to study someone in your medical fraternity. You want to determine, see, a lot of people have just researched depression among medical students in India, right? And their sample, like the people who they have just studied on, is just their college, right? There could be a bad HOD that's causing this depression. There could be bad teachers. There could be a group of bad seniors that are causing this depression. So that result is not applicable to the broader sense of the country, right? So that essentially becomes a paper that's completely, not completely, but relatively useless to someone sitting in Bombay when that paper is being done, say, in Chhattisgarh, right? So what you need to do is make sure that your specificities are not too narrow, that, oh, I'm just going to do it in my college, or not too broad, like, oh, I'm just doing depression in medical students in general. No, right? You want to make it narrow enough, but not too much. So there's a small exercise associated with this area, like topic research. So you you guys have to just say in your minds whether you think, or just write on the comment section whether you think that this topic is too broad, too narrow, or just right. I know the answers are here, but what do you think about rehabilitation for brain injuries? Do you think it's too narrow, too broad, or just right? And if anyone does think it's too narrow, just write in the comment section why they think it's too narrow. Okay. Too broad, right? So, okay, too broad, right? So, this actually activity was designed for in-person this thing, but unfortunately, since we are here, so rehabilitation for brain injuries does not answer any of the questions of who, what, why, where, and when, right? It just says rehabilitation for brain injuries, but it doesn't answer whether there's a specific pathology that I'm dealing with. Brain injuries can lead from subarachnoid hemorrhage to just a burst fracture of the skull or anything, right? Brain injuries are not defined properly. So how about the second topic that we have written here? So mirror therapy for brain injured or stroke patients with partial paralysis, right? So there it's defining what sort of rehabilitation that we're looking for. Rehabilitation can go from just giving a person anticoagulants to actually doing surgeries to doing a craniotomy, everything, right? So now they're talking about what are you doing? So mirror therapy is what's being done for brain injured or stroke patients with partial paralysis. So right then and there, you are defining who also, right? And this who is a much smaller who than just people who have brain injuries in general, because it's not a specific pathology. Brain injuries does not define a population, right? So again, let's move to the third one: health benefits of whole grains in a person's diet. Again, what sort of whole grains? For some people it may be chana. For some people it may be moong dal. For some, just whole grains, or just for some people it may be just rice. Sorry, it may be just corn or something. So health benefits, and what sort of health benefits are we talking about? Are we talking about decrease in depression? Are we talking about decrease in constipation levels? Are we just talking about decrease in weight? What sort of health benefits are we talking about? So again, it's too broad, right? So you have to define who, what, why, when, where, correct? So let's go. What are the causes of sprains in athletes? You might think that this topic may be just right because it's defined what sort of injury we're talking about. It's defined who we're talking about, right? However, have they said what sort of particular sprains are they talking about? Are they talking about a shoulder sprain? Are they talking about an ankle sprain? And athletes, maybe athletes is a little too broad. How about if I just do athletes involved in cricket, or athletes involved in football, or even athletes in general, but maybe then define an age group, right, of athletes from 15 to 30, because a person's um, propensity to get sprains is much higher when they are older, right? To get injured, to get sprains, much higher when they're older. So when they're younger, it's usually low. So that causes a disparity in your own results, because people will say, "Acha, isne to pura sabka dekh liya. So what's the point of this study?" Right? So let's move on to the next one. Do second-year medical students of Nair Hospital have major depressive disorder? So I'm from Nair Hospital, and maybe or maybe not that this is true, but like I said earlier, does this topic help people sitting in Chhattisgarh or Punjab or Haryana? No, it does not, because I've made it too narrow. Only second-year students in a particular hospital in a particular city having one particular disease, right? So I'm making it too specific. So I need to remove some of these aspects. So maybe instead of medical students just in Nair, I take just Bombay, in civic hospitals in Bombay, or I remove second year and I make it all in all years, right? So this is how, if I've come down to a too narrow a topic, I can move on to too big, right? Uh, so health needs of people in Odisha. I'm sorry about the spelling. It's actually Odisha. But after Hurricane Fanny in 2019, right? Again, what do you say? It's too broad, right? What sort of health needs? Are we talking about rates of gastroenteritis? Are we talking about rates of measles? What sort of health needs are we talking about, right? Again, health needs of elderly residents in Prabhat district, although this says it's just right, I would argue that it is still too broad because we haven't identified what sort of health needs are we talking about, right? But what this particular this thing does is it defines a particular district, because you going out and taking sample from the whole of Odisha is not possible for you. So you can talk about your own district or a specific district that you want to study, or 5 districts that you want to study, and then you can apply to whole of Odisha. But if you're saying in your research topic only that I want to study the health needs of people in all of Odisha, that won't be possible and people won't take you seriously, right? So the difference between a research topic and a research question is that once you have established your research topic, consider, like, let's just take an example, right? You want to do something with respect to stress and athletic performance among college students. Then you need to identify a particular research question that would highlight the outcome that you are trying to evaluate. For example, if you have come down on research topic stress and it's linked to athletic performance among college athletes, okay, this is your topic that you have come out with. So the research question that you can derive from this topic can be, what is the relationship with stress and athletic performance? Are people who are more stressed performing less well in sports? The second question that you can possibly ask yourself is, do college athletes experience greater levels of stress than other college students? Are people who are playing football in your college or in the cricket teams, football teams, do they have lesser stress than other people who are not? The third question can be, how do these college students cope with the stress, right? So once you have established your research topic based on your background research, based on talking to your seniors, talking to your faculty, talking to your HODs, you can then derive different research questions from that topic, right? People usually are confused between these two terms, and that's why I'm just trying to make it clear in your minds, right? So therefore, again, the overall approach needs to be like this conical cylinder, right? You start with a broad area in a subject in medicine, move on to establishing subtopics, then you formulate a research question after you have made your topic, right? So for example, there was like I spoke about yesterday, there was a study that I had performed in the 12th grade. I really wanted to do something about the health status of India's youth, and I'd seen many people being overweight in private school and not so many in 11th and 12th government aided colleges. So I went to a dietitian. I took her advice on what I should approach and how I should go about doing this. Although I didn't do it in much detail because I was in 12th, I'm like, it's just a research topic, I'm just going to do it. So through this background research, I was able to formulate a sort of a survey questionnaire where it had around 12 to 13 questions that distributed it to children of the ages 10 and 14, because why? So everything in research that you do, you have to define why you're doing it, right? So your next question in your mind would be why 10 and 14, right? So the dietitian advised me to think about people who were premenstrual and females who were postmenstrual, and just puberty in boys and girls in general, which would affect their BMI, which would affect their nutritional status. So this again is something I would not have thought about if I was doing this research on my own. But because I consulted an expert, I was able to search for it. I was able to establish it as a criteria in my article, right? So this is the final article title that's been published. So again, so this says comparison between nutritional status of private and public school students of ages 10 and 14 in Mumbai, India, right? So with this, I'm trying to basically tick off the who, what, where, when, and why. So when you are coming to this particular article, you know exactly what I am talking about. It's not about nutritional status in children of India, right? If that was the case, you would not know who I'm talking about, what I'm talking about, right? But here, you know exactly what was, just with the title, without just going beyond these 20 or so words, you know exactly what the rest of the research paper will hold, right? So again, I'm reiterating that it's imperative for you to ask what, why, how, when, so that you are able to narrowly identify your target population, right? Your target outcomes, and overall have a more focused idea on what you want to do and get out of your research, right? So once, it's very important initially for you to identify at least who you are going to be asking these questions, or who you are going to be studying, right? What you are going to be asking them, how will you do it? Everything has to be written down before, so that when you're doing it, you don't have to go back to the same person saying, oh, sorry, sir, I forgot to ask you this question. Will you please help me? That's 80% of the times no one's going to ask your question a second time. You can just imagine when you're going into a mall, half the times you don't even pick up the free flyers that people are handing out, right? So no one's, and just because it's a research, people are still not akin to, oh wow, I'm helping someone doing research. Trust me, they will not help you again, right? First time is a challenge itself. Second time is absolutely impossible. So you gather background information, you identify potential topics. You don't just sit on one, right? You identify, maybe if you're interested in orthopedics, and if you're interested in, say, cardiothoracic surgery, right? You identify a few topics, you visit their respective HODs, and then you sit down, and out of maybe 5 topics, one will work out for you. One HOD will be receptive. He'll say, okay, chalo, let's do this topic, and stuff like that, right? But you need to identify some sort of topic, either speaking to your HODs beforehand and then moving on towards creating a question with them, or doing your background research in subjects that you're interested in, and then moving on to the topic, then taking advice from, again, these experts on what the question again should be, right? Like I said, even one research topic can have 4, 5, 6 different sort of questions. So just to hone down on this, and actually a good way to narrow down or make your topic a little easier is just show it to your family members who are non-medicals. If they understand it, then you're going the right way, right? So another example of, a few examples of what topics, difference between the topics and questions, right? So if I say, what are the causes of sprains in athletes? I want to make it more specific. I want to know my target population. I want to know what exactly I'm going to be doing for them. So I'm going to insert question, what are the common risk factors for ankle sprains in adult athletes? Is a risk factor associated with the sport they're playing? Does football have more ankle sprains than cricket, or stuff like that? So I know exactly who I'm targeting. I have to target 5 different types of sports, right? So what are the best treatments for itching in hospitalized patients? So when you're saying the best treatments for itching, right, you need to identify what treatments you're going to give, because there must be 30 different drugs available in different combinations that a person is using for just sorting some sort of pruritus. But you need to be able to show something out of your research. You can't just say, "Ye best hai, maine search kiya," aisa nahi. So your research question should be comparison of 2 or more topical agents for effectiveness in reducing pruriceptive pruritus. So pruriceptive pruritus is a specific type of itching. Now, itching can be due to different things, and that will require different sorts of drugs that you're going to use for it. So you're making it more specific, so that if someone sees a lot of patients with this sort of pruritus. So pruritus is the name for itching for those first year students who don't know. Pruritus means itching, okay? So for some doctor who has lots of patients he's seeing with pruritus, he's come to your paper, he's saying, oh wow, this person has compared these 2 drugs, and I know now which to give my patients, right? Again, so last, we're going to discuss this pet therapy for 5-year-old autistic child. Again, now you've identified that you're dealing with autistic children. Okay, great. You identified the age group. Okay, great. But pet therapy meaning what? What are you trying to identify in the autistic child? Are you going to go to the autistic child, give them a pet, and say, "Sir, are you feeling better today?" That child is definitely not going to answer you, right? And what your question, in fact, should be is, does pet therapy provide benefits in social interaction and learning in children on the autistic disorder spectrum? So now, if you identify that you're dealing with autistic children, he or even his caregivers don't know what exactly that child is going through, right? So your end outcome, the outcome that you're evaluating, is whether there's improvement in the child's playing with other children, or if he is learning better with this pet therapy, right? Is it working? Sorry. Am I not visible?
Or visible.
Okay, some people on that. Anyways, so that's what you're trying to determine through this moving on from topics to research, right? So before finalizing your question, you need to make sure that it's focused enough. make sure you're taking on a project that is feasible. For example, if we continue to take the example of stress and athletic performance, measuring stress levels of each and every athlete who is going to your college is not feasible, right? Or taking even an extensive 20-minute interview to evaluate the stress levels that they're going through in even one college is not going to be feasible. Okay. So again, tips on feasibility can be taken from your guide. Suppose you're studying something about, say, the hand washing techniques, right? So you're going to say, okay, sir, I'm going to try to see if a normal alcoholic hand wash is better than your surgical scrub that you're doing. And now he will say, okay, so let's do this. Okay. Then you go to your college, you go to your residence and say, sir, for this surgery, don't do hand scrub, do only this. Do only the alcoholic hand sanitizer. What will that person say? Why should I trust you? I'm telling you, 70 to 80% of the people will just reject you and say, no, we have to do the surgical scrub. That's what we've been taught. And you have no evidence to suggest that it's better. So how can we risk the life of our patient, right? So such studies will not be feasible. So instead, what you can do is you can take just, normal medical students and ask them to wash their hands with scrub and then ask them to wash their hands with Sterilium and see which is better. That way you've made your study feasible, right? So when you're making your research protocol, make sure that it's feasible. Just think about all the different hurdles that you're going to face and try to overcome them before, so that when you're at that junction, you don't have to think about all these things. Just focus on collecting your data and just analyzing it, right? And if you require funding, determine your funding sources before. If you require any equipment, if you require any sort of, people who to work with you, you won't have to give their salaries and stuff. Just identify this before and just locate a funding source before you start your research. Because once you start your research, you'll be very disheartened if in the middle you run out of money, right? So make sure that these things are there. And also that there should be a novelty of an idea. It should not be something that, maybe someone has not done in your state or your country. But if there are 20 research papers already on that same topic, then you're not going to interest your audience, because it's not that the doctors of India in India just see papers cited by, just papers written by Indians, right? So to make sure that there's a novelty of an idea and the audience is interested, right? So this is a small 3 F's that you need to abide by when before finalizing your research question, right? And once you have identified it, just make sure there is a little clarity towards not only for yourself, but also to others who will be a part of your research, right? So how are social networking sites harmful? That's a very unclear signal that you're giving not only yourself, but also other people who are involved. So instead, you can make it clear by saying how are online users experiencing, addressing privacy issues on social networking sites like MySpace and Facebook. Here you've identified what your sites are going to be, what sort of user experience that you're trying to evaluate from these people here. Again, your focus, it should be very focused, not what is the effect on environment from global warming. No. I mean, that will be very impossible for you to determine, right? So instead, you take indirect associates with it. So global warming is associated with glacier melting. Okay. And how is glacier melting affecting penguins, right? So you make sure that even after you've established your research question, you're seeing that it's clear, it's focused, and it's not too complex, right? So how too simple would be, how are doctors addressing diabetes in India? Instead, you could just make it what are the common traits of people suffering from diabetes, and how can these be addressed by physicians, right? So if you just see doctors addressing diabetes in India, one, you'll have to take a sample from each state to make it India, right? And different doctors will have different perspectives, which you cannot change irrespective of what literature says, right? So instead, you just say, what are the common traits of people suffering from diabetes? Like, what are the common things that people present with in diabetes? And how can these be addressed by physicians? How physicians can address this to prevent the disease? So this gives you a little more just little more clarity, little more focus, and make sure that it's not too complex, right? So there are certain wrong ways of starting research, right? Thinking of a focus topic very early on in your research, making a Google form and sending it out on Facebook and WhatsApp, requesting friends and family to answer for your research project. This is something that, doesn't this remind you of something that marketing research campaigns do? This is basically done by companies who are trying to get feedbacks from you. Amazon sends you a feedback request every time you do this. So this is not the right way to do research. I'm not trying to nullify what these people are doing as a research, but it's not the right way to do research. So what differentiates us medical professionals from marketing research campaign is we need to be organized in our thoughts, establish some specific questions, and then take expert guidance to move on to answering our questions. Just because a topic is interesting or new to you does not mean that it's interesting or new to anyone else in the medical literature. Therefore, before realizing that your efforts are futile, it is better to perform some background research and then move on to spending your precious time that you have so little because of this course you're in, and then conduct your research. So again, it's important to understand the chronology that we are trying to establish here. You need to select a broad research area that you're interested in. Then perform thorough literature analysis on determining and what specific areas you should focus on. Then you should talk to some of your guides, some of your mentors in that particular area, determine what the new things in research are, okay? And then move on to making your research protocol and then finally performing your research, right? So doing all these things would definitely be the correct way of performing your research. So now that we have this, I spoke a lot about background information and literature analysis that we need to do. So from here, we're going to move on to studying about PubMed and how you can actually go through PubMed and limit your research results to exactly what you want, right? So if you have any questions on this particular topic, you can write them in the comment section for 5 minutes, and then we'll start with the next topic. Sometimes audience doesn't honestly fill the feedback form and cooperate with us. In such case, see, you can't force anyone to write a survey for you, right? So you need to establish some people who are, willing. So establish your audience in such a way that you know that they'll be willing to help you some way or the other, right? And don't be too dejected. Like if your sample size comes, I'm going to talk about sample size. Sample size is basically the number of people that you need to have in your study to prove that it's useful. So if your sample size comes 100, you don't just say, okay, I'm going to take 100 people from here. You take 500 people, right? Like here now in this conference also, you can see 1,400 people signed up to be part of this research workshop, right? And only 800 to 900 people are actually attending it and filling the forms regularly. So you need to make sure that your initial approach is very broad, and then you move on to smaller, and then you may not get that many results, and then you get, enough people that you really need in your particular thing. How do we conduct research during lockdown? So this is something that PubGeek is facing as well, because not a lot of doctors are even just, going to hospitals. They're just working in COVID wards. But soon we're going to have a volunteer opportunity for people. We're basically trying to analyze CT scans and RT-PCRs and X-rays and how effective they are in diagnosing COVID. So we're going to have a research opportunity for a few volunteers. We're going to post that on the website. So make sure that y'all just stay up to date with our Instagram, Facebook, and YouTube, so that when we do announce it, you're aware and we can go through that. So psychology, okay.
Sir, there is a question. Sir, how do we know if our topic is relevant for the audience or not? I mean, it is fruitful or not?
Okay, so one way you can think about it is, would that particular topic that I'm researching change the way that any doctor is treating his patients, or change the way that any doctor is thinking about the pathogenesis of a disease, right? And if you can answer these questions in the affirmative, you know that it's right. Because people will see, doctors are always looking for the next best drug, the next best treatment for their patients, because more patients they cure, more patients are happy, more patients come back to them, right? So when you're asking yourself about the audience, just make sure that you answer those questions. You answer those questions that they are looking the answers to. So it should not be something vague, or it should not be something that no one really is interested in, because it doesn't change the way they look at a disease or they are treating the disease, right? Even if it's just a very clinical, laboratory oriented research, it's fine, because that eventually will change the way that people think about disease, right? So I had done a study on how microRNA 122 is responsible for diabetes mellitus that is caused by HCV infection, right? And that's not changing the way that people are thinking about disease right now. But that article has been cited over 20 times, which means that people have drawn from that research and then used it for their own research to even further this hypothesis that we had, right? So that's what you should definitely be doing. Yeah, go on, let me.
There is another question. If I select a broader topic also in my methodology part based on criteria, we can narrow it. Like, can we narrow it on the basis of methodology?
Yeah, of course. So your method, so see, that's what I said. Your research topic, even if it's broad, if you just answer the questions who, what, why, when, where, you will automatically make it narrow. But if it's a very rare disease, if it's a very difficult topic, difficult people to find with that particular disease, or then you need to remove some of those specificities so that it's just right, not too narrow, not too broad, right? Okay, research and psychology, right? So psychology follows something called qualitative research, okay, where what people do is so unlike other researches which are objective, okay, where you ask a question, or you ask a person, how is your pain today? Suppose you've done a spine surgery, you're asking the patient, how is your pain today? Rate on a scale of 0 to 9. Okay, that person will say, okay, 7. And then you ask 1,000 patients this, the average is, okay, improvement from 3 before surgery to 8 after surgery average. Okay, but that's not how most psychology research works. Okay, psychology is basically based on something called qualitative methods, where you are supposed to be sitting down for an interview with a person who is suffering from the particular disease that you're studying, and you are not supposed you're not supposed to SNA, but you're not going to write down objectives, because you can't measure that how much better a person is feeling objectively, right? You have to ask that person subjectively, and then if many patients say, okay, I'm also feeling better each day, then in your research you would write, okay, most patients said that they were feeling better after this drug, and so on, so on, so on, so many side effects were faced. So psychology follows a little different way of doing research. It's a little more qualitative based, and it's a small section of whole of medical research. So yes, so anyway, seeing through PubMed and seeing this is something that psychology research people also definitely have to do. And but yeah, it follows a different protocol in how you go about things. It's not so objective based, it's not so statistics based, it's more based on qualitative research, right? So now let's move on to how we're going to basically search for our research papers, right? Whether you're a psychologist or whether you're a medical student, or whether just whatever you're doing, this is how a medical professional is going to search for his or her research articles. Okay, so how do you do background research? So we spoke a lot about the importance of performing background research, and we moved on to defining your research question. So how can you find the exact resource that you need to not only define your research question, but also move on to the background research on your defined research question, right? So what are some of the online resources that researchers use? How can you filter your results? Because just like Google, it's not like Google where you're just going to see the first page and figure out 5-6 things. No, you want an in-depth knowledge of a particular topic. So how are you going to get this in-depth knowledge is something that we're going to be seeing right now. And how can you access the research papers that you find through your filtered search? Okay, this is what we're going to be seeing today. So some of the online resources that are present are the most famous being Google Scholar and PubMed. There are lots of others like Web of Science Database, Embase, Cochrane, Scopus, Ovid. They all have a ton of papers inside them. But the most common and the largest sort of libraries that are present online are Google Scholar and PubMed, right? So a simple search in Google Scholar or PubMed can read you more than 1 million results at times, which are really difficult to filter through if you're trying to focus on a specific topic. And so what we need to do eventually is we need to sift through these billion articles and then read tens and hundreds of articles to make sure that they are exactly what you're looking for. But it's obviously not possible to go through these million results even if you just have to read the title, right? So we're going to show you a few tips and tricks on how you can filter your articles. Okay, how can you filter your search results to make sure that you only get what you're looking for? So let's start with Google Scholar. So as you can imagine, just like Google, the interface is exactly similar. However, the analyzing the results is objectively more difficult compared to PubMed. Okay. It's a problem of plenty. Similar to Google, it has indexed a large number of journals, and it's not filtered the journals that it gets. So Google Scholar, you cannot rely basically on the quality and the veracity of the articles, because Google essentially loves indexing things. And so even new journals that may not be that good, that are accepting papers just through fees or just through not proper peer review channels, they will be included in Google Scholar. And therefore, the results that you get are not completely reliable. Okay. Like I said, a problem of plenty. So how Google Scholar is different from PubMed is that PubMed actually filters out the journals for you. So um so the best journals in the world are indexed on PubMed. Okay. But all journals in the world will be indexed on Google Scholar. So how that's also good for you is because if you're searching for a topic that has not been researched so much, okay, and if that particular doctor didn't have enough money or time to go through a proper journal, he may have published, although his research methodology is good, he may have published in a tier 2 or a tier 3 journal, which may not be PubMed indexed, but it is indexed on Google Scholar, right? So there is a good and bad attached to PubMed and Google Scholar. And because Google Scholar just does not integrate only medical research, right? You'll find research from business, you'll find research from law, you'll find research from engineering, everything, right? So there is a huge problem of plenty that Google Scholar faces, but we are going to try to see if we can filter out your results for you. Okay. So how it helps beginners is, because it's an easy interface, it allows new research students to search for articles without any training. Unlike PubMed, Google Scholar is like Google, where you just type in your keywords and the results come for you. However, because of the huge number of results that you see in Google Scholar, it becomes important for the student to realize whether the article he is looking at has a sound research protocol. And we as medical students usually don't have that amount of knowledge and depth of knowledge that we can see an article and say, okay, wow, he has followed a good research protocol, I should rely on his or her research, and I should maybe follow that. So that's where Google Scholar helps and it takes away, is that it allows you to search simply, but the search results that you're getting may or may not be authentic enough for you to rely on. Okay. However, it still remains a very important tool to search for articles, and we'll be spending a little time to learn how to use it. So as we mentioned, the onus in this particular research method of Google Scholar is on the researcher to determine whether an article is useful to include in his background research or to refer in his article. You need to judge the quality of the article by reading through it. However, because you may not be well versed, we will give you some tips and tricks to how to determine this easily. So before you begin your search, it's important for you to define a few keywords by which you're going to search. For example, in the same study involving stress and athletic performance, my keywords would probably be stress, athletic performance, students, college, sports, etc. So I just want to define maybe 5 to 6 keywords before I start searching on these databases. So let's look at an example. I have included a few of my keywords in an actual Google Scholar search. You can see that I've returned with 1,59,000 results. Okay. This will prove to be a Herculean task to sift through so many articles and determine whether they will be important in my background research or not. You can yourself see that the first 4 results are all incoherent and not related to the topic at all. So the first 4 results are emotional and athletic performance, position of Academy of Nutrition and Dietetics. So these 4 results are actually not related to the topic that I'm trying to search. Okay. So the next step that I will do is maybe add in one more keyword. Okay. So to athletic performance, stress, and college, I've added sports. Okay. So now you can see that instead of 1.59 lakh results, I'm getting 1.11 lakh results. Now, although this may seem like a little decrease, but imagine it just adding one keyword has cut down my article searching by 40,000 words, 40,000 articles. thus demonstrating the importance of establishing keywords on your research before moving on to the background information collection phase. This will prevent you from wasting a lot of time in this phase of research preparation. We talk more about how you can further narrow down your research towards the end. For now, let's understand what information we are getting along with all our search results. Okay. Oh, you guys are not able to see?
Requesting to zoom in into the image.
Okay.
Yeah.
Does that work? Let's see.
Yeah, it does.
Good.
Yeah.
Okay. So let's now move on to what basic information that we are seeing in Google Scholar result. Okay. So in this sample result that I have received, it gives me a lot of information that someone who it looks quite different from the results I do get in Google search, right? So what is important to understand here is what sort of information that you're getting. So even before you open that link, you open that article, you take all that time and effort, you understand what the article is about and who has written it, how reliable is this information, right? So the first thing that you will see in the article is your author, right? The next thing that you will see is your journal. So the first few names that are present here, JF Buckman, DA Yusko, HR White, they are all names of authors, right? And if you are a particularly expert in your field, you will be able to know, okay, this author I've read from before, this author has a lot of articles, so maybe this author is good, right? The next thing that you will see is the journal. The journal that this particular study was published in is shown in the next sort of set of information that you're given. Then you see the year of publishing. Okay. So again, the year of publishing gives you information on how recent is this research. So as a general rule of thumb, it's not always followed based on what type of disease, what type of sort of drugs that you are searching. Your year of publishing should not be more than 5 years away. So usually when you're doing your background research, try to make sure that the articles that you're referring to are, say, if I'm doing it today, are not older than 2015. This is a general rule of thumb that we use. Not everyone follows it depending on how rare their particular disease that they're studying is. But this is a general rule of thumb. So that's why the year of publishing is also important, because if you see something like 1963, you're immediately alarmed saying, no, there's no need for me to open this article because it's just not applicable in today's world, right? And yes, there'll be articles from 1960, 1940, everything, because Google has indexed everything, right? So that is also an important aspect of this search result. Another thing that you see is number of citations, right? So for those of you who don't know what citations is, so it's basically says cited by 68, which means that 68 other research papers have cited this. So now we talk about what exactly is a citation, okay? It's basically the number of times that a particular article has been quoted or mentioned in other published articles, right? So in other Google Scholar results, this particular article has been mentioned 68 times, like we saw. So that means that, and therefore, it is an indicator of, at least a vague indicator of the reliability of the article. Because as you can think that 68 people have actually gone through the article, they have cited that article because they thought that the results were good, because they thought that the results were important. It means that, yes, it is reliable, right? So usually the figure that I use is around 40 to 50. If an article has been cited more than 40 to 50 times, then you definitely know that it's very reliable, right? But it's not that articles that have not been cited are not reliable, okay? Because articles that are not cited may just be new. People may not have been exposed to all of them yet, and that's why it's a crude indicator of the reliability of the article, which you'll need when you're sifting through your Google Scholar results. So as you can see, there are different options that are available in Google Scholar, right? I'm just gonna make this small for all of you. So now we're gonna talk about how to filter our results. And these are the options on the left. Some advanced options that are given to you to filter your results. Just like in maybe you've seen shopping websites where they ask you shirt, pant, this company, and so on. Okay. So the initial thing gives you an option of filtering through your timeline, through if you want to see a particular research since 2020, since 2019, since 2016, etc. Then it gives you a sort by relevance or sort by date, which is usually not important. Then it says include patents and include citations, right? So you can definitely tick off the include patents mark, because patents, at least in your basic research, will most likely not be important to you, right? And another cool thing about this is that you can create an alert, which means that anytime a new article is published with the same keywords that you have typed in now, Google Scholar will immediately alert you so that you can stay up to date with um, with your research and with your planning, right? Then we move on to options available in Google Scholar. Okay. So Google Scholar, unlike PubMed, gives you a lot of other options that you can use to your benefit. And some of them are thus. So like I said, so the first star option that you see in any Google Scholar result is, the first star that you see in any Google Scholar result will give you the option of saving that result to your library. Okay. So what that does is, when you're going through, say, 1,000 articles or 1,500 articles, you want to just save a few of them, and you've seen just the maybe the author's name, the journal in which it's published, the year, and the title, and you want to say, okay, this requires further perusal or further looking into, right? So this gives you an option to save the result to your library, so that if at the first glance you determine that this meets your searching categories and this deserves a further read, right? Cite article gives you a way to see in which you can cite this article in your references. That will come in later when you're writing your paper. We'll discuss that eventually. Again, the cited by others. In this paper, it's cited by 109 people. So I know that it's important. But again, I see up and I see the date is 1998, right? So then it may or may not be important to my particular search, depending on what I'm searching on. And again, on Google Scholar, there's this special link which on the right which says PDF in brackets, and then it gives you a link. So what you guys, first-time researchers, need to know about is that many articles on the internet are actually not free for people to read. You just get the abstract and you get the title. Okay, abstract is a short form of the whole article, maybe 200 words. So they've narrowed down a 3,000 word article into 200 words. So how Google Scholar helps you in this aspect, whenever there's a link on the right of a search result, you will see that when you click that link, a free article is given to you. So that means you read the full text of the article for free, right? So that's always a good link. That's always a good way to see if you're on a budget or if you don't have access to these articles that are paid, then you can definitely use this method so that you don't have to again search for the article in Google and then again, open it in the fullscape view. Okay. So now let's move on to another feature that is available, is called related articles. Okay. So once you see, okay, that this particular article is exactly what I am interested in. So you have used maybe 3 or 4 keywords to arrive at this article. However, Google's algorithm uses more than hundreds, 200, maybe sometimes even 1,000 keywords, which identifies an article exactly, right? So if you have found an article that perfectly meets your needs, you can click on this button and Google will automatically search its database and give you results that are 80 to 90% related to the article you've selected. You still need to filter out your results. However, they will be much less than the results that you were currently seeing. So for example, I have gotten 159,000 or 1.59 lakh results in athletic performance, stress, and college. I've identified this as an article that I find exactly suits my needs, right? And then I search on related articles and then I just get 101 results, right? So it doesn't cut down your article number to such a low number that you think, okay, I'm just getting 1 or 2 results, I can't, use this button. But it gives you 101 results on of articles that are similar to the ones that you have exactly. So just make sure that your articles that you are selecting for this view similar articles button are exactly meet your needs, right? Because from 1.59 lakh results, I'm moving on to 101 results. Okay. So then let's move on to something called advanced search in Google Scholar. Okay. So again, on the left pane, you will find advanced search option. Once you click these 3 dots as commonly you do, and then you click advanced search, you'll find this particular thing in your you'll find this particular pane that opens up, and it may seem confusing at first, but I'm going to break it down for you. Okay. So you need to find articles using keywords as I've already said. Just make sure you have established a few keywords before you start doing this. So when you type any word in the blank space after with all of the words, it means that the search result should contain each and every word that you have mentioned in that text box. For example, if you search for college, doping, stress, athletes, all these words will need to be contained in the article for it to show up as a result. Okay. Then the next this thing of with the exact phrase. Okay. So exact phrases can be used for terms such as doping agency, where you don't want doping and agency to be 2 separate words, right? So exact phrases can even be longer than that, can be athletes and stress. It can be any exact phrase that you're looking for depending on your research. Okay. With at least one of the words means that if you type in again doping, athlete, stress, college, the articles with at least one of the words will turn up, right? So you'll obviously get many more results with at least one of the words option instead of with all of the words, right? Again, if you know which author you're really looking for, you can write articles, return articles authored by a particular author or published in a particular journal. Again, did between 2015 and 2019, you can make your selection accordingly, right? So these two are usually the ones that are most commonly used. They are with all of the words and with the exact phrase, so that you are actually just narrowing down your search results without too much without troubling yourself too much, right? Again, I've spoken about these. So then let's talk about Google Alerts. Okay. Once again, you click on these 3 bars and it shows you something called alerts. So what Google Alerts does is it basically sets up an alert for you if any search result is added to this words that you have searched for. So say today, suppose I search for college doping, college doping, stress, athletics. Okay. And if tomorrow I search the same thing, maybe 2 or 3 more results will be added, right? So I can set up an alert for exact search keywords to make sure that any new articles that are being published, I can directly get without having to search again. And maybe that article will be, much lower in the result list. So that won't happen. You will get alerts automatically. Okay. Okay. So some insider tips for Google. Okay. If you put your search results in quotation marks, okay, if you don't want to use the advanced feature, you don't want to rack your brain, okay, quotation marks help you bypass the advanced search option. Any words that you put between quotation marks will be exactly searched. For example, if you put college student, the articles with college student will have to be there. With the words college student will have to be there. Football player, the articles with the words football player will have to be there. It'll match your exact phrase. Okay. Another important thing is that word order matters. Okay. If your paper is on doping in college students in USA, doping is the most important object of your search and therefore should be at the start of your search. Okay. So once you've established your 6 or 7 keywords, you establish them in hierarchy also. You say, okay, this is more important than this is more important than this, etc., etc. So that when you're searching also, you use the words in that order so that you're not again met with a lot of articles that are completely useless to you. Okay. Another feature that not many people know about is, again, like I said, Google My Library. If you just click on the star whenever a search pops up, and every article will have a star next to it. So if you just want to filter out your 10 or 15 or 20 or 30 articles, you can just click on the star. They'll automatically go to My Library, and you can view them there instead of opening it, then again opening a new tab, again searching on Google and have 50 tabs open on your browser, right? So now that we have got this, congratulations. You have enough knowledge of Google Scholar to perform your own searches and be able to appropriately filter out the results. Be sure to use it before your next research project. However, you wouldn't be a true researcher if you do not know how to use the upcoming database, which is PubMed. Okay. The most organized, sought after, and scary database for amateur researchers. This is miles away from Google Scholar, both in terms of searching parameters as well as the results that you will receive. Okay. Because PubMed is maintained by the National Library of Medicine in the US, and they make sure that the results that you are getting are absolutely from the best journals, and they can be completely relied upon. Okay, so PubMed, and in fact, is used by most senior consultants to determine what new technologies and what new advancements have been made in their particular field. Okay, so one thing, the first benefit of PubMed is, again, that it's limited only to medical sciences and its affiliates. There will be no, unlike Google Scholar, there will be no articles from engineering colleges. There'll be no articles from lawyers. There'll be no articles from, there'll be no patents. There'll be no excess, basically stuff that you will never ever have to use for your research project. Okay, it's doctors only, and and this itself will decrease the amount of search results that you will need to sift through, right? Again, it's the most sought after database. It has very stringent protocols and requirements for including journals in their search results. And therefore, the journals, and by extension, the articles in PubMed, are already pre-vetted by professionals. So you can rest your mind at ease for using any of these articles for your research requirements. Okay. So just a little history on how we actually got PubMed. Now, everyone knows the word PubMed, but how it actually came about was that in 1879, okay, the National Library of Medicine started indexing all the biomedical literature. So basically what indexing means is, consider you have your books, right? Everyday books. And then the start of it is the index. So index basically means putting everything in one database in a systematic manner so that it can be found later on, right? Your index is maybe 2 sides, like Harrison's index is maybe 10 sides or 20 sides, but the content is for 3,000, 4,000 pages, right? So index is basically to have a systematic order in which you've pointed out the contents of that book or that database so that people can find it easily. Okay. So imagine they started this in 1879. Okay. And at that time, obviously no computers were available. They made a data set of all this literature present, all the journals that they had included in physical form. And this was called something called Index Medicus. Okay. So with the computer age, they decided to make online database called Medline. And in 1996, they decided to give free access to this Medline database from an online search portal called PubMed. Okay. So Medline is the actual database that houses all these journals and stuff. And PubMed is just a way to search them. Okay. So as you can imagine, the amount of articles in PubMed will not be less. Okay. Since it has archives from 1879 onwards. Okay. So there are more than 30 million articles with more than 5,200 different journals. Right? So searching on it is not an easy task, because it's not that, okay, I'm just going to search on it and I'm going to find what I want. No, there are still 30 million articles that you have to sift through. Okay. But one, maybe to those of you who have used PubMed in the past, I have good and bad news. The PubMed interface is being upgraded and is available to people from this, and was available to people for this Jan 2020. The good news is that the old interface is still available. The bad news is we don't know for how long it will be available, and therefore it's in everyone's interest to learn how to use the new interface of PubMed. And we'll be focused only on the new interface so that you guys are updated and you all don't need to do this lecture series all over again. Okay. So if you happen to go to the old PubMed website, a banner will appear when you visit the old PubMed website saying, okay, let's click here to go to the new PubMed. Okay. And then you will go to this particular page that looks sort of like that. But before we move on to actually we can search on PubMed, it's not as easy as Google Scholar, and that's why we need something called mesh vocabulary. Okay. So mesh basically stands for medical subject headings. I know it sounds complicated. It sounds like, wow, some technical AI stuff is there, but that's not the case. Okay, it just stands for medical subject headings, which is basically a list of headings with which PubMed is indexed. Okay, so they're basically how PubMed, to understand how to search on PubMed, you have to understand how it works, right? So if an article is added to PubMed, okay, it is scanned through by a lot of these people called indexers, okay, and they themselves give out at least 10 to 15 keywords to that article. And if you use those keywords, that article will pop up in your search result. Okay, it's basically used to categorize these articles. Okay, and these words that they used cannot be arbitrary. They cannot be for salt. Like for example, if you consider salt can be called NaCl, can be KCl, can be any chemical salt in the world. Okay. Then for example, hypertension. Some people might call it high BP. Some people might call it hypertension. Some people might just say, use words like vasoconstriction for it, or a lot of stuff like medical language, as you may have already known, has a lot of synonyms for it. There can be some certain syndrome which is actually called something else, right? So therefore, it's important to establish specific words with which the research articles will be indexed in these big, huge 30 million article databases. So not only is it easy for finding it, but also it's easy for people to, put it on there and categorize them, right? So how you can use mesh to refine your search is basically, let me just increase the zoom in on this, right? So mesh is again freely available online. Okay, mesh is basically by, again, the National Library of Medicine, which hosts PubMed. Okay, so what you can do is you can go on the mesh website. Okay, it's hosted on the same database, and before we search in this database, we just need to understand what mesh is and how we can search in it. So basically, there are a few type of mesh words. Okay. Yeah. So there are a few type of mesh words, and they are heading, subheading, publication types, and supplementary concept records. You do not need to care about the last two. Okay. And so basically, headings are a biomedical concept. Okay. For example, if your heading is typhoid, okay, your subheading could be it's typhoid etiology, typhoid treatment, typhoid epidemiology, etc. Okay, so we are just going to focus on headings and subheadings. So headings is essentially a concept, a biomedical concept, or say a particular disease, or say hypertension. These are usually your headings, and subheadings are specifiers. So if a paper is talking about whether penicillin can treat typhoid, your subheading, it would have the subheading, it would have the heading of typhoid, and the subheading would be treatment. Understanding? So this is how the mesh words are made, and this is how indexers will read that whole article and say, okay, this is the heading I'm going to assign it, this is the subheading. So if anyone searches with these words, then they'll be able to find this particular article. Okay, everyone following so far? Okay, so then we have mesh headings over here. These are the 13 different types of mesh headings. You really don't need to know about them. And this is the mesh tree. So like I said, each word in this image is itself a heading. And the only difference between higher branches and lower branches is the specificity of the word. So these are all headings. Okay, these are all mesh headings. And as you can see, the highest heading is head. Then in head, you have face, you have eye, you have eyebrow, eyelids, eyelashes. Okay. For example, if your study was based on the effect of corticosteroid therapy on the eye, okay, you can see that you can either use the more specific word eyelashes, or you could just select the heading eye, which would include your eyebrows, eyelashes, eyelids, everything, right? So this is how the mesh tree heading tree is made. And this is how indexers actually use each specific word to index it. So suppose an indexer has used the word eyelids, okay? Then that, if a person searches for eye, okay? Then in eye, if a person searches for eye also, everything with eyebrows, eyelid, and eyelashes will turn up. If a person searches for face, there'll be face, there'll be eye, there'll be mouth, there'll be nose, everything, right? So this is what basically mesh terms are, and that's why it's more important for you to be just select the heading which is the most specific for your particular research. Okay. So again, as you can see, one is anatomy category, body region, and again is sense organ. Then again in eye only, anterior capsule, anterior aspect. So you don't need to know any of these. You'll be able to simply search them. But this is just an example how the tree structure of the mesh works. Okay. Okay. So what you need to do now is once you've established your 5-6 keywords, right? You need to determine whether they are mesh headings or not. Because if suppose you're using some word that is not used to index the article on PubMed, you will not be able to find it accurately, right? So suppose I'm using the words, um, suppose I'm using the word high BP instead of hypertension, I will not be able to find specific articles on PubMed, right? So now you're going to search for the headings. So suppose again we're taking the example of the athlete, stress, college, steroids, stuff like that, and we go to the mesh website and we type heading. We go and we search, and then we in the options we say main heading, description term, because that's what we're searching, right? So I did a search and I took it for athletes. Okay. So athlete is a mesh descriptor, which means that it is a word used by these indexers to put put articles up on PubMed. And also there is something called a scope note, so that your definition of athletes and theirs is the same. So scope note says individuals who have developed skills, physical stamina, and strength. So you know that this is the term athletes that I'm looking for, and the definition is the same. Okay. So okay, so one keyword I can use, chalo, one keyword I can use in PubMed. And the next that we will use is, suppose I want to see if stress is a keyword or not. So I type in stress here, select main headings is what I'm searching for. And so then when I searched for stress, it said it had no results. As you can see in the bottom, it says no results for stress. Let me just zoom it in for you. It says no results for stress in main heading terms. So now I think, what are the alternatives to stress? What are the some of the other words that people can use instead of stress, right? So I think of, let's see, anxiety. So anxiety, anxiety is basically it is a mesh word, okay, which means that I can use it as my descriptor, which I can use it as my keyword, okay. So I need, if I don't have the specific keywords that I'm looking for, I use anxiety and I get into these details of anxiety, and I know that because there is a search result found for it, it is used as a header, okay. So for all UG students that are on right now, maybe first year, second year, you don't need to know this mesh vocabulary right now, because I would still recommend that most of y'all use PubMed. However, you don't need to go into the depths of mesh vocabulary, because you can find out articles on your own. I'm sure you will have good guides who will help you out. But just to understand the concept, so that if at a later date you want to do this, you'll definitely be able to, with a few reminders to what this whole thing was, right? So now we've dealt with mesh headings. I've found athletes. I have found anxiety. I know now that stress is something that I would have probably used in PubMed, but if I had used it, I would not get the articles that I really wanted. Okay. So now we described this stress stuff. Now let's move on to subheadings. Okay. So after you've established your headings, um, like I said, if a heading is measles, subheading can be its epidemiology, its therapy, its etiology, etc. Okay. So that you know exactly what you're looking for. So once you have selected your heading, you can view the subheadings qualified that are used with that heading. So it's not that you have to search for subheadings again. Okay. So now suppose, let's take the example of gastroparesis. So maybe for undergrad students don't know what gastroparesis is. Gastroparesis is basically paralysis of the stomach. Okay. Where the stomach is not pumping out its food effectively. Okay. You don't need to know. We're not going to talk too much about it, but just the word gastroparesis means that. Okay. So now in that same way, I have gone on the mesh website, I have put gastroparesis in the search bar, and I have selected main mesh heading, and voila, it turns up gastroparesis. Okay. So the first thing I will do is confirm whether the definition is the same as what I'm looking for. So now you all probably can't read this, but it's saying gastroparesis is chronic delayed gastric emptying, okay, which is essentially paralysis of the stomach. And now if I want to see the subheadings that I can use with gastroparesis while searching for my articles on PubMed, okay, so instead of therapy, someone might say management. Instead of treatment, someone might say drugs, right? So what are the specific terms that I can use with gastroparesis which will yield the best results? So here you can see all the subheadings that are associated with gastroparesis. So let me just zoom it in for you so that you have a better idea of what we're talking about. You can see all the headings. As you can see, it says allowable qualifiers are blood, cerebrospinal fluid, chemically induced, complications, diagnosis, diet therapy, drug therapy. So these are all phrases and words that I can use along with this gastroparesis to further refine my search so that I'm met with a limited number of articles that are very important to me so that I can only look at them, study them, and see what my search results I want. Okay. So now that we have learned this whole new topic of mesh vocabulary, now why is all of this of use to us? Okay. Like I said, since all of these are indexed, all of these articles are indexed in the PubMed using these same words. Knowing what words to use makes your search very specific and limited to articles of interest. Okay. As I said, there are more than 30 million articles, and it is very important to limit your search, or you will go mad just trying to sift through the extra articles that are useless to you, right? So for example, if I performed this search actually on PubMed, and if I search for bladder inflammation, okay, it gives me 16,491 results, right? Because it's not a mesh index word. But if I use cystitis, which is just another word for bladder inflammation, I get 14,000 results. So already just by using a mesh term, I have cut down my search by 14,000. Now why 14,000 also too much? Because I have not used a subheading along with this, right? And that will further decrease the number of results I'm getting. But as you can see, almost 10% of the results are decreased just by using one mesh term, not even two. Okay. So now let's move on to how you're going to search in PubMed with a mesh term. Okay. So in this particular search, I have done gastroparesis. I want to search about the different types of diagnoses that are used for gastroparesis. Okay. So I've typed in gastroparesis. I put a slash. Okay. Which is basically I call it a slash. I don't know what you guys call it, but slash, and then I put diagnosis so that PubMed knows that gastroparesis is the heading and diagnosis is the subheading. Okay. So just now, if you can see, I have just as an example of saying how. So if you just put words inside the PubMed search bar without saying that they are mesh words, then PubMed does not recognize them as mesh words. Okay. So in this example, I have searched gastroparesis and space diagnosis. If I don't put the slash, PubMed does not realize that both are mesh terms and they are specific words that I have used after going through the whole mesh library. So it gives me results of gastroparesis and diagnosis, which turns out to be 1706. Okay, not bad, but still, if I was just to put a slash between these two, just see, if I just put a slash between gastroparesis and diagnosis, it has cut down my search results to 543. Okay. So it has removed 68% of the articles for me from my initial search, just because now it knows exactly what I'm looking for. Okay. So now you have basically understood the topic of headings and subheadings, okay, that are used in PubMed that now you can use for PubMed. So now, as we saw the tree diagram where eye can be divided into eyelid, into eyelash. Now, what if you want to further improve your search from there? Okay. Suppose you didn't know that eyelid, you didn't think of using eyelid. You just thought eye and I'm just going to use eye. Okay, and you found it's a mesh term and you used it. What if you want to further refine your heading to be the most specific? Okay. Again, you search on your mesh database, you search for, suppose I say phototherapy. Suppose my study is on how neonates phototherapy is used for jaundice. Okay, suppose I'm studying on that. So I search for phototherapy. And I think, okay, maybe there is a more specific term for phototherapy that I can use for my heading. So I go to this, first is details, second is qualified, third is a mesh tree structures. Okay, I click on that and it gives me basically the division of phototherapy that PubMed uses to describe its article on mesh. Okay. So from phototherapy, I have gone from color therapy, heliotherapy, intest. So now I know that I want to use I want to use ultraviolet therapy because that's what's used for neonates and jaundice. So now instead of using phototherapy, which would have given me results for color therapy, heliotherapy, intest, for everything, articles on all these keywords, I'm going to just focus on ultraviolet therapy because I want to make sure that my articles are limited. Okay. Phew. So now we have finished our major issue of mesh library and how it helps in searching for PubMed. Okay. So mesh is a separate search tool that has to be used before PubMed research. Okay. It's not a search tool per se. It's just a website where you just type in your keywords and see whether it's a mesh term or not. Okay. So now we move on to how do you actually search on PubMed? Okay. Be specific, no punctuation, no Boolean operators. Okay. No tags. Suppose you say author, Agrawal, journal, IMJ, title, searching for gastric cancer. No, you're not going to get answer to that because PubMed does not differentiate between these words. Okay. So no punctuation should be used, no comma and stuff, because PubMed will not realize it as different words. That's not how PubMed works. Okay. So search results, again, to filter your results, there are some options available on the left where you can filter through date. You can filter if it's a free full text is available for people who don't have access to a lot of subscription services where they give you access to different journals. So you can use you can get only articles which have a free full text available for your search. Okay, and then there's something called additional filters that you can use, which will lead you to a whole lot of different stuff that maybe is not really pertinent to you. Okay. So now you've understood how to use the slash between heading and subheading. And now you've understood how to basically just search on PubMed, right? But what if you have more than one heading? What if you have more than one subheading? Okay. So we're going to move on to the advanced method of PubMed. And I know this session may be a little long, but we just got 10 slides left, and you're really going to understand how PubMed works, and you will never ask anyone else, and you maybe even want to teach them because it's such a fascinating concept of PubMed that you're able to get so many research articles on specific topics. Okay, so just 10 minutes and we'll end this session. We'll hope to end this session by 8 o'clock. Okay, it won't take more than 10 to 15 minutes. So once you go on this advanced method of PubMed, okay, you'll come up with this dialog box. Okay, and in this dialog box you will see basically these options. Okay, I hope this is visible to everyone. You will see add terms to the query box. So the query box basically means your search term. Okay, in the all fields option, you will instead select, now because you're an expert at mesh and you know all your mesh vocabulary, it's time to impress PubMed with it. Okay, so you go on that and you select mesh major topics. Okay, that will be an option. Just on that all fields option, you go on mesh major topics and you type in gastroparesis. Okay, and you say add. Okay, you say add, and now add will have 3 different options: add with and, add with or add with not. Now again, you're confused. What should I do? Right? So now what add or not means? How many of you remember these gates that we used to do in 12th? Right? These and or not gates. Okay, so this is a similar concept. They're called Boolean operators. Okay, so and means that results only which have both word A and word B. Like remember in Google Scholars we had done all of the words. It's similar to that. Okay, or means results which have either word A or B. If you're not sure about say therapy or diagnosis, so you want both, not therapy and diagnosis, you want therapy or diagnosis. So then you see the word, use the word or. And if you want to use the word not, it will exclude results that have the word you have mentioned. Suppose if I search for, again, phototherapy and neonate, and I type not thalassemia, it will exclude all studies that have the word thalassemia in them. Okay, so this way you can filter out your search much better. Yeah, exactly. Logic gates is what we are basically studying. It's the same Boolean operator stuff that PubMed uses. Okay, so just to hone this in your head, and Boolean operator means that you are searching for results which will have both, suppose salmonella and hamburger in it. So if salmonella individually has 64,000 results, hamburger has 2,500 results, salmonella and hamburger have only 12 results, right? So if you can see the Venn diagram that is there on the right side of the screen, you will see that it's basically searching for those common topics, okay? Or it's basically you want whether or not all the words are there, you want all these results. So if I'm searching for football or hockey or soccer, not only am I going to get results with football and soccer, hockey and football, or maybe all three together, but I'm also going to get results for their articles in which they're individually present, okay? So if football has 4,800, hockey has 1,000, soccer has 2,500, the total results that I'm going to get are going to be the most. Now, when would you want to use the OR operator? Is when your research question is a little limited and little more focused little more focused, and there are less research topics away. There are less research done already on that topic. Okay, so that's when you use this OR gate. And NOT gate is whenever, suppose I say arthritis, not letter. Okay, so it will give me all the articles with arthritis, but also it will exclude the articles which have both arthritis and letter in them. Okay, so make sure that you completely don't want that, because there will be some articles of arthritis and letter, but since the word letter is included in them, they'd be removed from your search results. Okay. Okay, so this is how you can combine multiple fields. You can add and or, but this is a little more complex for your search results. So we just use this. Okay, we just use the previous Boolean operators that we've studied. So we have, if you can see in the query box, we have added gastroparesis as a mesh major topic. Now I again go to this option of selecting what terms I'm adding and select mesh subheading. Okay, and I add etiology. And I say add etiology with and, because I want to search with gastroparesis and etiology. Both should definitely be present in my study. Okay, so I add that to my query box now. Now, again, I want to make sure that there is no epidemiology results coming. I don't want any study that mentions any epidemiology of gastroparesis. So then again, I go on mesh subheadings. I type epidemiology. I say add with not. So this will be my final search query. Okay, I will have results which have both gastroparesis and etiology, but any results which have epidemiology will completely not show up in my search results. Okay. So now you have finally found your paper, but now you realize that, oh, I need to pay access. I need to pay for access to access my paper, to really see what this paper is actually about. Okay. So what are you going to do? You know, each paper, let me tell you, costs around 45 to sometimes 60, even $60 to just view the paper. Just to be able to download the paper, you'll have to pay 4,000 rupees. That's just one paper. And it's recommended that you at least go to 30 papers to just complete your background research. So there's no way that someone like us who doesn't actually, make that much money, even interns don't make that much money, and we're not going to pay 40, 50,000 rupees to just access a few papers for our research. So what are some of the alternatives that you can use? The first thing that you really should do is ask your college librarian if she has access to publisher. I belong to a civic hospital in Mumbai, and I thought, nahi, government ke paas to kuch access nahi hota, but I was surprised to find that my college also had access to BMJ, it had access to Scopus, and it actually had access to actually a lot of journal articles that I would have otherwise not been able to access without it. So first step, I would say, although in this lockdown time, you may not be able to do that, but as soon as college opens, ask them if they have access to the publisher. The second is something called ResearchGate. So ResearchGate, like Facebook, is basically a community of researchers. Okay, there you'll find the latest research that people are up to. They'll upload their projects, they'll upload their papers for free. Okay, and if journals give authors the right to do that, they'll upload their research papers for free. Even you can message some of the authors saying, sir, please, I'm a medical student, I want to access your research. And most of the times may take a day or two, but they'll reply to your request and they'll send you the paper. Another is something called unpaywall.org. It's a completely legal extension for Chrome. Okay, you use that, you go on the website, that's a paywall, you click on that and it just becomes free. You get to download it for free. Okay, I don't know how they do it, but it is completely legal. or there is something called open access website. So what open access means is that it's open for the world to access. There is in open access websites, and there are some open access journals as well, where all articles are available free of cost. Okay. So if you search for these particular journals and just make sure that your search results, if you want, are just limited to these journals, then you can do that and you can access these papers for free, so that you're not met with this thing of, oh, how am I going to access this paper? It's a perfect paper for me. Okay. So there are some illegal resources that you can use in your own free time. I personally, I feel that it's unfair to publishers if you use these illegal websites to access research, to get access to. There's something called Sci-Hub, and the other is LibGen. Some people do use it, but it prevents the authors from realizing that there is a read on their article, and it prevents journals from actually collecting revenue. So you can explore them on your own time, but it's actually completely illegal to use these. And that's going to be the end of our session today. If you have any questions, do let me know. I'm still going to be on for 8 minutes, or maybe even more, depending on the questions. So do let me know if you have any questions. I'll be happy to answer them.
Sir, there is a question. As there are, hello?
Yeah, tell me.
Yeah, as there are many research going on worldwide, how do we know that our choice of topic is being done by others or not? Or the analytical data we use in future, it must not be called as plagiarism.
So see, for plagiarism, okay, we're going to talk about plagiarism in the next module tomorrow. Plagiarism is not based on data. So if you have some researcher who's done a particular research, okay, you are not going to be charged with plagiarism, because just because you have followed the same research steps that he has done, that's not called plagiarism. Plagiarism is when you're actually copying and pasting text from someone else and saying it's your own. Okay, so that's definitely not going to be counted as plagiarism. When you talk about something that's new, okay, yes, you're depending on, there's a race to the finish line. You and another researcher are on that same platform trying to finish the same thing. You may be left behind in that race. But if you're the only two people working on that particular research, you're not going to have too much trouble getting it published, right? No one's going to accuse you of plagiarism. Okay, just like, don't worry about that. Any other questions?
Yeah. Can we take the data that relates to our research topic from our residents that work on somewhat same topic?
Come again, sorry.
Can we take the data that relates to our research topic from our residents that works on the somewhat same topic? Like if a resident who is doing a research on the similar topic, can we take data from such research topics?
Okay, see, no, because that's something called salami slicing. Okay, so salami slicing is basically taking one data set and cutting it down into different data sets and then publishing it as different papers. Okay, so that's something that definitely should not be done, because it undermines the research results that you're actually getting. So what happens is that, am I visible? Is it all good?
Yes.
Yeah.
Yes, you are visible.
Okay. Yeah. So that's what happens, and that you should not do that. It's not ethical to do that. And before any research study, you need to have approval from ethics committee, which we'll talk about on the last day of our workshop, about how to get approval, what is the ethics committee, why you should get approval and stuff. So our ethics committee will not give you approval for such a research, and every journal that you publish on will require you to have this approval from the ethics committee.
There is another question that has popped out many times. How many students can work on the same research?
There is no limit. There's absolutely no limit. See, I'll tell you, most journals have a limit of 6 authors. Okay, most journals, not all. Some have unlimited, they have like no limits on authors. But some do have limits, and Yeah, so some do have limits, but you want to make sure that before you start your research, everyone knows what their roles are. So it should be fight ki, yaar, main first author nahi, tu first author nahi, main first author nahi, tu first author. That should not be the case, because research should bring people together, not, drive them apart just for recognition. So just make sure in the start you have ki, okay, I'm putting so much work. I'm going to be first author. You're going to be second, third, fourth, fifth. Just make it clear. Okay. So that people don't think ki, acha, haan, main to author bane wala. And then in the end, you're like, nahi, sirf 6 hain. So most journals have a maximum of 6 authors that you can have on a paper. Okay. Yeah, so you can have even 1,000 people working on the paper. You can have, there's something called an acknowledgement section in each paper. We're going to talk about all these sections tomorrow. But there's something called acknowledgement section where you can acknowledge each and every person, each and every organization that has helped you with your research.
There is another question called, what would be the reliable database for interdisciplinary research?
Sorry, I can't hear you. What would be the reliable database for?
Interdisciplinary researches.
PubMed. Oh, interdisciplinary as in?
Maybe the person who questioned the same thing, maybe she is relating like interdepartmental, like wherever we use psyche or some other department, they work together for a
PubMed. Any department, interdepartment, whatever it is. If it's medical, it's PubMed. Rely on PubMed for sure.
Okay, sir, this is a question from my side. Recently, I went through so many messages coming into my inbox stating to fill up a Google form for COVID research, mainly mental health one. I don't know how far it is ethical to fill up that form to give away data regarding the same, because some of them weren't anonymous, and some of them required some personal data like underlying diseases, conditions you have, or the medications you take, and all those things. And people were like, we want to publish it, can we do that without ethical clearance from the college or the ethical committee of the college?
See, what happens is, like I told you, there'll be a ton of journals that will accept your article for a cheap sum. Okay. But the journals that are actually legitimate, where they have people from AIMS, from JIPMER, from the best institutes in India working, even just Indian journals I'm talking about, internationals is a whole different thing. They will know what your research is exactly about. If you've just taken a Google form, done a survey without any thought to the question, without conducting any previous research on what the current scenario is, on what the current research that has already been published is, they're not going to accept your article. Okay. And it's very disheartening that, after you perform this research, even though, like, we talk about the ethical aspect of it on another situation. Okay. That's a whole other deal. But it's just in general very disheartening when you've worked hard on your paper, even though it's just a Google form, you've taken your time, you've shared it with your friends, you share it with everyone, and you aren't able to publish it. Okay. So what I would recommend, and also it's completely, if a person finds that you have not gotten ethical clearance before starting your research, your reputation would be in the dumps. Period. If a journal, so if you get it published, okay, and you have said, okay, every journal requires you to say, okay, I have gotten ethics committee approval. And if you've published it and you've not gotten ethics committee approval actually, and someone in the future says, hey, I want to see this person's ethics committee approval, and you're not able to provide it, your article is going to be rescinded. You're going to face all sorts of career changing moments in your life, because no one is going to trust your authenticity just because in medical school you had done this. So avoid as far as possible doing that, because that's really not something that you should get into. Because right now you may feel that publishing a paper is awesome, I'm a medical student, I'm publishing papers, but don't sacrifice your ethics for it. Can we conduct research with someone? Absolutely. My first research was with someone outside the country. The paper that you saw was actually with someone based in the US as well. We both had conducted that research.
Yes.
Few good Indian medical journals. Indian medical, yeah, tell me.
There is a question. I guess it would be answered in upcoming sessions. What is the exact procedure to get your research published in some famous journals? I
Right.
guess we are going to talk about it in the
Yeah,
upcoming
exactly.
sessions.
Exactly. So tomorrow we're going to talk about how a research paper is actually framed, how you can quickly read a research paper and let it go, but how you're going to actually write your paper once you have your data with you, how you're going to analyze that data. So tomorrow we're going to be doing that for sure.
Yeah, sure.
How do you make it standardized a grading for qualitative studies? So if you do that, your study is not going to be qualitative anymore. It's going to be quantitative, right? So qualitative studies by their very nature are not based on numbers. They're based on subjective things like how a patient is feeling and just subjective reactions to drugs, subjective reaction to therapy and stuff.
Yes.
There
is a question you mentioned about being involved
I
with
just
the
read it. I just read
residents.
it. Yeah. So basically, how being involved with residents is you get to become the resident's friend. Okay. B is you're gonna do his cut work. Yes, you're gonna do his cut work, but it's gonna give you exposure into what he is doing wrong. Maybe you'll advise him on something. Maybe it'll make you more aware of how research is actually conducted. See, sitting in a room and talking about research is very easy, but actually going out into the world, figuring out what the barriers are that research faces in every day. Like suppose I started Google form today, spell it, I said, oh, I have 1,000 friends on Facebook. I'll at least 800 will answer, but I'll realize that no, only 30 answer. So then I realized, okay, so I have to contact people through WhatsApp, I have to contact people through Instagram. But you understand, that's the smallest hurdle that you have to face in research, right? And always, all the residents that are working on thesis, their thesis has to be about something that's new, and B, always in clinical branches, always patient related, right? So you will get a lot of exposure from these places that will not only help you devise your own research, but it'll also help you work with that resident. So if in the future also he has any projects, he'll be like, "हाँ, ये बंदा अच्छा है, इसको ले लेते हैं, मेरे साथ research कर लेगा," right?
Yes.
Yeah. Any others? Any other research opportunities for UG students other than ICMR? Honestly, you make your own research. Like, don't ICMR STS is basically not a research opportunity. You have basically, they're just giving you like 10,000 a month. It's not a research opportunity per se. You have done your own work, you have made your own protocol, and you're just giving it to ICMR, right? So just start on your own with that research. Go to your HODs, go to your faculty, because anyways you want to have a guide for SDS, right? Do your own research. It doesn't matter. You may take 6 months, 8 months, 10 months, 1 year for your first paper, but just start your own so that next time when you do it, you'll find it much easier. You know the roadblocks that you face. How to collaborate with someone from outside the country. Know someone outside the country, but write them on ResearchGate. See, once if you publish 5-6 papers, okay, and suppose I've worked, like yesterday I've worked with Dr. Neil. I've published 3 or 4 papers with him, right? So now whenever he has a paper to do, he obviously doesn't have time to do this cut work, to do background literature, to write the paper actually. So he calls me. He'll tell me, Anirudh, I have this paper. I have just the data ready. Make a paper out of it. And I'll in a week or two, I'll have a paper ready for him, right? And if I do a good job, he'll tell 5 other people, right? So initially, what you can do is just try to contact people, say, sir, do you need any help? Just through ResearchGate or whatever it is. Just एक तुक्का मार दो, max क्या होगा ना बोलेगा वो, right? That's how you can collaborate with other people, collaborate with doctors, right? But also PubGeek is actually that's what we're trying to do, is that students who are scared of collaborating with doctors, who don't know what sort of project the doctors are working on. Because if the doctor says yes, then you'll have to do it, right? So that's what we're trying to do. We're trying to bridge the gap between doctors who want to do research and students who need these research opportunities, right? So you want to not only be exposed, but most doctors even agree to put the student's name in the article that PubGeek is publishing. So one paper we had was on DHS, which is dynamic hip screw fixation in orthopedics. So there, the 4 people that are working, it's still in the pre-submission phase. The 4 people that were working on that study have added their names as authors in that paper. So depending on what the doctor wants and what the doctor feels, and if those people work for him, he directly tell them to chalo next project ye hai. So look for these opportunities, not only PubGeek, but a lot of SNO Chattisgarh also is organizing a lot of these research workshops for you so that you can, have that exposure, have that level of clarity in your head before you begin your own research. Trust me, it's not an easy task to perform a good research. All right. So just for that clarity, just for the sake of the head, it's okay to do scut work as long as you're getting that.
Yes.
Yeah.
There is another question. If after deciding my research topic and question, I find that a lot of exactly similar research has been conducted previously, does that still make my research fruitful?
So that's what I said. That's why I see before you completed your paper, you realize that it's already done, right? And in that whole phase of your research question, like that small video that you had seen, you are not supposed to identify your research question even before you have started your background research. So you may have a vague topic in your head, right? And you'll go to PubMed, you'll go to Google Scholar, you find different articles on it, right? You'll say, okay, maybe this topic, if framed in this way, is new, right? So that's great that you found out. It's actually better that you found out before conducting your research that it's not going to be fruitful. Like it's not new. So what new stuff am I doing, right? And maybe if you change your question in a certain way, maybe you talk about just say Indian population, or you're talking about some other treatment method to it. Maybe it's new then. So at least you've established that before you've done all the work for it. We have time for one last question, and then I think we stop for the day.
Yes, sir. How do we know that the people or doctors want to be researched?
So that's what I'm saying. So you go on ResearchGate, you'll see the number of articles that a doctor publishes. And trust me, all doctors would love free help from medical students to do their research. Okay. You see if they're active in researching, see what type of research projects they're working on. And if that you find that interesting, just write to them. Simple as that. And yeah, and like PubGeek is useful for BDS students because eventually we are planning to work with dentists also who are working on their own research projects. So right now everything is stuck because of COVID, because not many people are going to hospitals to do anything other than COVID, right? But eventually, maybe in like I said, this month we might have something related to COVID, some data management that you can do from home, and we'll publish that shortly on the website. But yeah, just stay tuned for that if you guys are interested. Any other questions? Are we done for the day?
Yes, sir. Most of the questions it will be answered in the upcoming sessions.
Yeah, in tomorrow's session. Yeah.
Yeah.
And so please, guys, again, subscribe to this channel. Follow SNO Chattisgarh on Instagram. Follow PubGeek on Instagram to be updated with all the workshops that we're bringing you, all the new information that's available. And PubGeek is also going to have every Sunday we're going to have a 20-minute session with some of the other expert in research. So you can tune into that, see what their expertise are, see what their opinions are. So starting from next Sunday, we're going to do it. So please subscribe to this channel so that you're alerted when that happens, and you can maybe spend 10 to 15 minutes of your day just seeing what's new in research, hearing from experts in their field, right? It's great talking to you all. I'll see you all tomorrow by 6. A great turnout. We'll shortly send you the link for the whole questionnaire that you have to answer. Maybe we'll send you by tomorrow morning and we'll keep it on till later because I think we've passed our time today. So we'll send it to you tomorrow morning and you can answer on your own free time. All right?
Yes, sure.
All right. Bye-bye.
Thank you so much, sir.